So hello everyone. Thank you so much for logging on for today's webinar, Living Well Online Health Series, Digital Health Literacy, How to Find and Understand Health Information on the Internet. This web series is brought to you by 5210 Plus Gallatin and Bozeman Health. My name is Danica Comey and I work for Bozeman Health as the Community Engagement Coordinator. We are excited to be offering our online Living Well series and sincerely thank you for your engagement and participation today. Before I turn the presentation over to Sarah, I do want to first cover some logistics about using Zoom. So Sarah will present for 20 minutes and then we'll have about 5 to 10 minutes available for question and answer. Everyone has been muted upon their entry to the webinar. Please keep yourself muted during the presentation. After the presentation, there will be an opportunity for the question and answer, and at that time, please make sure to unmute yourself so that you can ask your questions directly to the presenter. If you're having any technical issues, please use the chat box feature and I will communicate with you directly to get your tech issues resolved. The webinar is being recorded and it will be shared on Bozeman Health's YouTube channel. I encourage you to complete our post-presentation survey, which will be emailed to you today after the completion of the presentation. Finally, please check back onto Bozeman Health's website, bozemanhealth.org/community-education, to see our upcoming Living Well presentations. You can also follow us on social media. We have Facebook and Instagram accounts for both Bozeman Health and 5210 Plus Gallatin. Please also follow the Belgrade Community Library. So Sarah Creech is the Adult Services Librarian at the Belgrade Community Library. She has a Level 1 Consumer Health Information Specialization from the Medical Library Association, an Administer Track Montana State Library certification with specializations in library services to the public and collection management and technical services, as well as a Master's in Library and Information Science from the University of Wisconsin-Milwaukee. Her goal as a librarian is to help people find the information that they need and want to make their lives better and easier. Before her career as a librarian, Sarah was a food scientist and can always be guaranteed to chat about food, cooking, baking, and eating. Now it's my pleasure to turn it over to Sarah.
Hi, and thanks for joining us for this Living Well presentation on digital health literacy. A big thank you to Danica, Bozeman Health, and the 5210 Plus Gallatin County for putting this series together. I'm honored to be a part of it. As Danica said, my name is Sarah Creech, and I'm here to walk you through some digital literacy skills and then a little further into some digital health literacy specifically. Feel free to stop me with any questions, but it does sound like there's going to be time for Q&A, and I will make sure to pause a few times to check for understanding. So this is my contact information and a little bit about me. And what kind of health webinar would this be without a disclaimer? I do have a master's degree, a consumer health specialization, and a Montana State Library certification, but I am not a medical professional. The information presented today is not meant to act as medical advice, and I would strongly advise you to consult with your doctor or medical professional before using information from this presentation to make medical decisions. This disclaimer that's up on the screen is on our website underneath the health resources, and all library staff that assist people that come into the library, we are very careful to state that we are not medical professionals when we're assisting them. So I just wanted you to have that same information as well. Since we only have about 20 minutes today, I figured we could probably get through 5 objectives. The first one is to know the terms and phrases digital literacy and health literacy. Then we'll go over some basic internet search techniques. Like the description said, Google is a librarian's friend as well. I also want you to be able to understand how to read search results on Google specifically. And then I want to go through vetted websites versus dangerous websites and 3 techniques to determine what is trustworthy or not. And then finally, we'll get into some specific health information sites. And there are many out there. I figured we'd start with the ones that the Belgrade Library has on our health resources page. So These are all starting points. Every objective up here, these are just very basic starting points for both digital and health literacy. And there are entire college courses on how to search effectively. And there's an entire network of medical libraries that are continuously improving how people can search for health information on the internet. So essentially, we're not going to be experts after this presentation, but we'll have starting points and you'll have a good place to begin. So, digital literacy, ability to use information and communication technologies to find, evaluate, create, and communicate information requiring both cognitive and technical skills. That's from the American Library Association definition of digital literacy. And the question I ask, if you are able to understand and find information you need on the internet, and then can you use it, that information, to get to a point, to get a point across or to create something new. And that's how I kind of define digital literacy, and that's what we'll use today for the searching techniques. And then health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. And that's from the Institute of Medicine. So the question I would ask is, can you find the health information you're looking for and then process it enough to help you make decisions related to your medical health or for someone you care for or about? Today, we're going to combine the two. We'll have a brief digital literacy lesson on search techniques, results list understanding, and good versus bad website identification. And then we'll use those skills to look at health websites to help you improve your health literacy. So to start, some search techniques. So Boolean operators. The most basic search technique is a Boolean operator search. And this is all based on the work of an English mathematician, George Boole, who lived in the 1800s. This can get very technical and dry very quickly, but the easiest sense of the idea is that Boolean operators are ways to limit your search or expand your search on the internet to be more specific or less specific, hopefully saving you time in the long run. So the AND function will search for results that have both keywords. So if you wanted to find something that has, like, let's say for a recipe, you have asparagus and potatoes, and you want a recipe that uses both, you would use AND if you were to search Google. You'd search asparagus and potatoes, and it would only show up results that have both of those words listed. This also means that results with only one of the keywords will not show up. So if it just has asparagus, but it doesn't mention potatoes anywhere on that website, it will not show up in the results list. The dash is essentially the subtraction sign. Sometimes you'll see it as not or no. This search function will exclude keywords from showing up in your results. I would be aware of this one though. Be wary of using the subtraction sign or not, because there's a danger it might not show all of the results that you're looking for. You might not think something's relevant, but then it might be. An example would be if you are allergic to garlic. So if you never want any recipes to show up with garlic in them, you can do asparagus and then the subtraction sign garlic, and it will not show up. Garlic will not show up in your results list. The OR function will expand your search results so that all results contain at least one of the keywords on either side. An example would be if you're not sure if something's going to be phrased as environmental or natural resources when you're searching for policies, you can search environmental policy or natural resources policy. And both results will come up. They might not have those same keywords in the same results, but results showing both of those keywords will show up. Quotation marks, use those around a phrase that needs to be returned in the exact order that it's written. An example would be like something that means two different things if not in the exact order, or if you're searching for a technical phrase or something like that. And then parentheses marks priority for keywords. and it searches for those items first. It's like the PEMDAS equation for math, parentheses comes first. So it'll search for those, and then it'll search for anything outside the parentheses. And then some other kind of fun things. If you just search define and then a word in Google, it'll bring up a definition. And then other fun things, including like Google will do math for you. If you just put in, 77 times 204 and press enter, you don't even need an equals sign. It'll come up with the answer in the top part. And then you can search, if you have a Gmail account and you're logged in while you're searching, you can search my reservations or my flights, and it'll bring you your specific results. It'll track packages for you. If you just type in any tracking number, it'll direct you to the appropriate tracking method, either USPS or UPS or FedEx or anything else really. If you need to convert currency or units, you can search ML to L or pounds to dollars or dollars to euro or anything like that, and it'll give you the answer. And then you can also check the weather. If you just type in weather and then the city and state you're looking for, it'll bring up the weather immediately. So that's kind of fun. Okay. So I'm gonna take you through to some searches, and I'm going to show you a little bit of what we talked about. So asparagus and potatoes. So these are all recipes that have both potatoes and asparagus in them. You'll see that not one of these results has just asparagus or just potatoes. So, and then if you wanted to change that to say not garlic, which is the little subtraction sign, and press search, and if you just scroll down, none of these recipes have garlic in them. And you can kind of briefly tell that because there's no bolded words in the short description. I like this example just because of where I work. So Belgrade, not Serbia. Oh, see, it didn't work. Well, all right, never mind on that one. And then the or, so environmental or natural resources. And it'll come up with both. And then an exact term would be the quotes. And it'll show up with exact phrases. And then parentheses. Another trick with parentheses is to think about it as multiple search terms at once. So bird watching or birding and technique. So it'll search for bird watching or birding, and then it'll search for technique. So it'll have at least 2 keywords, maybe 3 in the final search results. Okay, so let's go on to the next. So while we have a search results list up, I'll show you a little bit about how to maybe better understand what you're looking at. So I'll show you where the ad locations are. Pretty much no matter what you search now, there will be a related advertisement that comes up. Those are going to be marked with a bold ad at the top left of the result. They're the first 1 to 5 results typically, and they can sometimes be in the right-hand bar of the search results as well. Then definitions, if you don't use the define search function that we talked about before, sometimes the definition will still pop up anyway in that right-hand column. Business information, if you search for a business, the business information, including their Google rating and reviews and phone number and website, etc., they'll also come up in the right-hand column. And then this is called Google Business, and it is always worth double checking, especially during COVID-19 closures. They're not always the most accurate anymore. Before, I'd say they were 90 to 95% accurate, but I would double check with the business before you rely on the Google Business information right now. At the bottom of your search results list, you'll see similar or related search terms, and these are lists of frequently searched terms related to what you've already searched. Maybe it pulls out a keyword or a phrase or a different way of writing it that might get you better or more accurate results. And then settings and tools. If you're looking for news items, you can use the tools feature to search for items that were published within a specific time frame. So there's within the last hour, 24 hours, week, month, year, or a custom range of dates. And then also in tools, if your kids are searching, or if you know the terms you're searching for can easily be misconstrued as obscene, you can turn on safe search in the settings menu. And then you can also change your results list to have more than 10 results on the first page, which is the default for Google. And then if you're looking for images, you can search for images that are in the public domain in a variety of ways. So I'm going to go back to those results and let's look at the Ayurveda again. So you can see that there's a definition just from Wikipedia over on this right-hand sidebar. It doesn't look like there's an ad for Ayurveda, which is surprising. But there are some businesses if you scroll down. Let's see. And then at the very bottom, you have the searches related to Ayurveda. These are the most common searches related to this keyword. And then we'll scroll back up to the very top. So this is tools where you can choose the time the post was published. You can search for all results are verbatim. And then settings is where you can turn on safe search for if you know your kids are using Google. And this is also a function that you can set for Google Chrome in general, just so it's always on. And then if you go to, these are all the options you can search for. And then if we go to images, I'll show you where you can search for the public domain. So if you go to images and then tools, usage rights is where you can make sure what you're using is not going to violate any copyright laws, which is important to librarians. That's a little bit about search results. Are there any questions before we keep going? Danica, did you see any questions come in?
No questions so far.
Okay, perfect. Then we'll go on to vetted website versus dangerous website. So this is always going to be a little tricky, but the three that I use and the three that we direct patrons to use, especially when it comes to health information, is trust it or trash it, CRaap, and then use the ABCs. So I'll take you through each of these three a little bit so you can get an idea of the questions to ask if you're trying to figure out if a website is trustworthy. So trust it or trash it. The first question is, who said it? Who wrote it? Who provided the facts? Where did the facts come from? And who paid for it? And then each of these has a little check mark, like think about trusting it if, think about trashing it if. And then there's when did they say it? If it's current, think about trusting it. If a date for the information isn't given, think about trashing it. And then how did they know? How do you know this information pertains to you? Maybe the medical information is based on the research of many people, then you should trust it. Or if it's just someone's opinion or individual experience, you might consider trashing it. And then does the information seem reasonable? There's no other sources with the same information. It could be new cutting edge research. That's a good trust it reason. But if there's no other sources with the same information and it seems too good to be true, it may be too good to be true. So think about trashing it. So I like this one because it's a click through and you can go through each one and develop some critical thinking skills about the information that you're looking at. And this pertains to websites as well as print resources. Like if you find a pamphlet or even a book, you can usually answer all of these questions from looking at the book. You might have to do some additional research, but this is a pretty user-friendly way to think about it. And then, oh no, there it is. Okay. So, and then CRaap is currency, relevancy, authority, accuracy, and purpose. So currency, health information becomes outdated quickly. Is this information current? And then some other questions. Relevancy, is the information relevant and appropriate for this user or information needs? So is it information for a child when you're finding information, when you're hoping to find information for an older adult or a senior? Might not be as relevant. Authority, is the author or publisher an authoritative, reliable source? What are their credentials, etc.? Are they qualified? Accuracy, the reliability of the information presented. Is there evidence for that reliability? Has the information been reviewed? Can you verify any of it with another source or from personal knowledge? And then finally, purpose. Sometimes the information is provided as a way to sell a product. Is this the case? So do they make their intentions clear? Is the information fact, opinion, or propaganda? Are there political or ideological or cultural or religious or institutional or personal biases? These are all really good questions to ask when you're looking at health information. And then finally, use the ABCs. ABCs are accuracy and authority. So is it accurate? Is it authoritative? And then there's bias or objectivity. So is it just one point of view? Who sponsored it? Beware of capital letters, exclamation points, words like miracle, cure. Currency and timeliness. Is there a date? Do the links work? Has there been more recent research? And then coverage. Is it complete? And are there sources given? Do you know where the information is coming from? So we're gonna, go through some websites. So this website, dhmo.org. This is one of my favorite websites. Does anyone know what dihydrogen monoxide is? It's kind of a rhetorical question, but another way of writing that is H2O or water. But this is an actual website that's out there. I'm pretty sure everybody knows that this is one of like the most well-known hoax websites, but it's an example of, if you go through and you just look at this website, you know, it's asking for PayPal. There's a date that it was updated. It's, you know, National Consumer Coalition. It's made to look very important and serious. This looks like a pretty official seal. You know, it's asking you can support the cause. So just beware of things like this. There's an alerts and advisories. You can sign up for updates. Just be cautious, I guess, is the moral of the story with this one. But also, like, if you're interested, read through this website. It's kind of, once you know that it's water, it's kind of amusing almost, like, oh yeah, it makes up 80% of your body. And then it goes on to talk about, and because of this, all of these things happen. And it just gives me a chuckle every time I think about it. Okay, so next would be this one. We talked about being cautious of things that say miracle cure. And this is an example. I'll show you this website. It immediately is asking, we'd like to show you notifications. It wants to know your email address so you can be the first to know now. There's no real link to what is actually in this book. And there's no source of, like, who is writing this. And then at the bottom, these are mostly what's called clickbait. They're headlines to get you to click on things. So this is not necessarily a trusted website. And I would just be cautious when you find websites like this, especially now that they're popping up more frequently with COVID-19 keeping people home and maybe a little scared and they want a cure. This goes for things like detox teas to help you lose weight, and anything, like I said, anything miracle and more. There's so many of these out there. And then finally, this one. This is the Washington State Department of Health. So this is a trusted website. And I would say that because everything that they link to is a source file, or and you'll notice that there's no ads on this page, and it's a .gov site, and those are a little harder to get a hold of than .com, .net, or .org sites. Those are available to anyone who can pay the fee to reserve them. So just keep that in mind. Okay, so health information on the internet, there is vetted and trusted information out there for every age. There's sites dedicated to children and teens, parents, senior citizens, and older adults, and non-speaking people. So hopefully these tips help everybody in attendance. And I'm going to take us through pretty much the sites on the Belgrade Community Library's Health Resources page. I put this together just as a starting point. So it's not the be-all, end-all of good health information on the internet, but it is a good starting point. So if you start at this page, if you're not sure where to go for specifically health information, like if you have a question, start here, and it'll get you a little more comfortable. So I'll show you what that page looks like. If you just go to belgradelibrary.org/resources, it's going to look like this. So you would click on health because that's this topic, and then you can click through to each one if you want. So Medline Plus is a general health information site. And sorry, it's a service of the National Library of Medicine and the world's largest medical library, which is part of the National Institutes of Health, the NIH. And their mission is to present high quality, relevant health and wellness information that is trusted, easy to understand, free of advertising in both English and Spanish. And it's anywhere, anytime, on any device for free. So just a few tips for Medline Plus. This left-hand sidebar right here is the majority of the information, or starting points for this site. You can click through and search by alphabet for each of these things, or for the health topics, you can search by body, location, and systems. If you're not sure what it is, but it has something to do with your eyes, you can search for everything related to your eyes and vision. And then you can also read about the medical tests that may have been recommended by your doctor. And there's a lot of healthy recipes. And it's by meal or by diet. Then we'll close out of that one. And then the next one is accessing health information in languages other than English. So this is still Medline Plus. And at the bottom of that homepage, there was a link that said health information in multiple languages. So you can just go here, choose the language you're interested in, and search for resources available in those languages. Not everything will be available in every language, but again, it's a good starting point. The second resource I'd recommend for finding health information in a language other than English is Health Reach, which is through the NIH as well. With this one though, I would change the language in the search and then any other filters you want if you know you want a video or audio instead of a document. And then you can search by author, but then you can just search in the search bar for the term you're looking for, and it'll bring it up in the language that you have requested if it exists. Okay, so that's health information in other languages. Then we have accessing information for kids and teens, and then I'll show you as well, it includes parents. So this first one is, I think it's pronounced Nemours, which is a nonprofit group. There's specific homepages for each audience that feature a popular article, maybe a frequently asked question, sometimes a quiz, and a list of hot topics. So if you click through to the parents site, there's 4 main buttons related to what they're featuring right now, or you can go through and search up here based on what it is you're looking for. And the same thing goes for the kids site. There's a home page, and then you can search for something specific or for teens. And this is useful for parents, especially because they'll be able to know what the kids have access to or are reading, and they can maybe get ways to talk to their kids about different things. And then the other information for, other website for kids and teens is healthychildren.org from the American Academy of Pediatrics. It offers resources and articles on every stage of development from prenatal to young adult. And there's information about the growth and development for each stage, and a Find the Pediatrician feature, which is helpful. So you can just put in the zip code you're looking for and it'll come up with resources. But if you're wondering, like, my toddler isn't doing this thing yet, should they be, you can click through and look at the development charts and their growth and what they should be doing for physical and social and cognitively. And it's all vetted with no ads. So, all right. Then, if you're a little older than a young adult, you can go to the National Institutes of Health, National Institute on Aging, specifically the health information page. It has everything kind of broken out into topics that are most frequently searched for older adults and seniors. You can browse through all of them if you're not sure what you're looking for, or if you're just curious even to learn about what your parents are going through or your grandparents are going through. You can maybe help them that way. And again, there's no ads on this site, and it's not asking you for any personal information. All right, so the last piece on this health resources page is accessing information that's not typically considered conventional medicine. So that is through the National Center for Complementary and Integrative Health, which is again part of the NIH. And their mission is to define through rigorous scientific investigation the usefulness and safety of complementary and integrative health interventions and their roles in improving health and healthcare. So this is anything that might not be considered conventional. So it might be considered acupuncture or chiropractic medicine or yoga or Tai Chi, or aromatherapy or meditation. All of these things are part of the complementary and integrative health. And most people who use non-mainstream approaches also use conventional healthcare. So the difference between alternative and complementary, they are different, is that if a non-mainstream practice is used together with conventional medicine, that's called complementary because it's working together. And then if a non-mainstream practice is used in place of conventional medicine, that's considered alternative. So if instead of doing conventional medicine or going to your normal doctor or general practitioner, you do something else, that would be considered alternative. But if you're doing that and something that's non-mainstream, that would be complementary. And then this has a bunch of things on herbs and the science behind integrative and complementary and alternative medicines. Has some highlights and research. It's very transparent about where the funding comes from. And you can learn, if you're curious about what's included, the index is actually really helpful. Antioxidants, anything related to the potential disease, and not necessarily cures, but treatments or ways to get support. So that's that. Let me make sure I got all of the slides. Health Reach, Kids Health, Healthy Children, Institute on Aging, and CCIH. And that is everything. Any questions?
Sarah, thank you so much. That was amazing. I learned so much.
Yay.
So we'll open it up. Are there any questions? I do want to say I haven't done a Boolean search in years, and I'm excited to go home this evening and try with some cool new recipes.
Yeah, it's kind of fun for the kitchen.
Yeah, absolutely. I do have a question about, and I know that you briefly mentioned it, but could you talk a little bit more about the differences between .com, .org, and .gov?
Yes, yeah. So, great question. So .com, .net, those, okay. So .com is basically any website. You can go, you can buy the domain. No, anyone can buy any .com if it's available. There's no real restrictions. .net is for, I read that it's a network of websites. So it might be like groups of websites together would be under a .net. .org is similar to a .com in that you can just buy it if you want it, but you might have to have some nonprofit documentation showing that you either work for or own or are starting a nonprofit. There's some more regulations than that, I bet, but it's still pretty much like if you go in and you have some documentation, you can buy it. And .gov is just for government organizations. And then there was one more I was going to mention. And now I can't remember.
.edu?
Yeah, yep, and thank you. Thank you, Tanika. .edu is for just that educational groups, like universities typically. Yeah.
Very interesting. Yeah, I have, thank you for clarifying that, because I had heard essentially that there was not as big of a difference between .com and .org as some people might have thought, but I didn't understand that.
Yeah, and I would still agree with that. There's still not that much of a difference, but the idea is, or at least the intent was, I think, that a .org is non-profit groups specifically.
Awesome.
Yeah.
Cool.
Yeah.
Well, do we have any other questions? No? Sarah, thank you so much for your presentation today.
Yeah, thanks, Danica. It was fun.
Cool. Yep. And that's it. We're done.
Okay, cool.
I'm sorry nobody was here live.
Oh, that's okay. I didn't even know.